And now we will move on to the last question. And Dr.go and Dr.go and Mr. Mamura will give us their insights. Dr.go, based on your 20 years of experience working at the Korean CDC, how will the government and private sector partner to strengthen national system and prepare them for next challenges?
Thank you, Dr. Lee. I think the answer lies in Korea's successful response to COVID-19 pandemic, especially in initial stage, which early case detection and contact tracing has critical role. Korea CDC has collaborated with academia, the Korean Society of Laboratory Medicine, and large commercial laboratories, and Korean government could increase the laboratory testing capacity dramatically. I think government needs to incorporate these success factors when preparing future pandemic. During the preparing pandemic, I think collaboration with private sector will be important. Government need to review the lessons learned from the COVID-19 response and find the challenges and the gaps for improvement. We have experienced significant progress in the development and introduction of new diagnostics. We have witnessed the increased national capacity for PCR tests and antigen rapid tests, and using digital tools that link the patient and healthcare providers. We have all those improvements, so not to lose this momentum and to prepare future pandemic, government should support research and development activities, especially in private sector, including universities, IVD manufacturers, and independent laboratories. One of the research areas will be like increasing gene sequencing capacity, research on innovative manufacturing technologies in developing diagnostics, and innovative diagnosis service model. Thank you very much.
Thank you once again, Dr.go. And finally, Mr. Mamura, what are your thoughts on this question in light of your experience as CEO of United? That institution is international organization in funding the diagnosis, treatment, and prevention of disease in low-income and middle-income countries. Mr. Mamura.
Global challenges need global solutions, and global solutions need global concerted efforts. And there are very important actors that need to be coordinated. Globally, it is absolutely fundamental that governments, international organizations, industry, civil society, and product development partnerships work together. That is a fundamental element for a global response being effective. And COVID was a very good example of that. If we look at the last 2 years, we have seen an unprecedented collaboration between these different actors. We see governments putting money on the table for the industry, developing, researching, manufacturing more, being better players for global health, for the benefit of the patients. We see industry also accelerating their R&D projects and accelerating their capacity to manufacture more to supply these demanding markets. We see product development partnerships like FIND or other PDPs like TB Alliance or Medicines and Malaria Venture also putting their contribution on the service to fulfill these necessities. We see governments deploying new methodologies, new mechanisms for funding these new areas requiring innovation. like rapid acceleration diagnostics in the United States, the famous RADx, or the BARDA, also in the US, or new tools in the European Union. In Korea, the Right Fund, for example, is a fund dedicated to fund innovation with Korean pharma and biotech and medtech industries. And all these accelerators for improving our capacity to research, to develop, to manufacture, and to commercialize has had an enormous impact in creating a more stronger capacity to cope with this crisis, but also, and this is probably the most difficult and the most fascinating, in my opinion, part, it is creating a different dynamics between the different actors. It's not just about money. It's not just about the new products or the quantitative increment of the manufacturing production. It's the way we work together, the way the government supports the industry, the way sometimes stringent regulatory frameworks adapt much better, like with these emergency use authorizations, to approve and to incorporate these innovations faster. This is the only way we can transform a new product into a solution. An innovation without scale up is just an invention. It's not an innovation. An innovation without patients using that innovation doesn't change the reality. We need that innovation being produced, being commercialized, being affordable, being demonstrated their effectiveness, and replacing an old methodology for treating patients or for diagnosing. So let's not forget this. It's very important that all these actors are coordinated without egos, without territorialities, but in a real partnership to change the reality.
I really appreciate your thought. And it is time to open questions for you.
So today we have been discussing and we have been hearing about several things, about the evolution of the diagnostics markets globally. We heard about the evolution of the IVD market in different regions. We had, in a nutshell, in very few minutes, a short presentation of each region. What are the principal characteristics of these markets? We also spoke about this collaboration between the public and the private and the importance of it. So we would like to hear from you, what are your thoughts about that? What do you think, based on your experience, should be done, should be working better? And also, of course, questions to any one of the panelists. So the floor is open.
Any questions or comments?
Yes, over there. We have a microphone there. Yes.
Thank you so much for the presentation. I have a question. My name is Abiodun Ajaygan from Nigeria. And so my question is, in view of the growing IVD markets over the next decades, what are your expectations of the actors of these growing markets from low to medium income countries? Since we know that most of the IVDs we use are from either the Western countries or the Asian countries. And because of the unstable economy, most times the laboratories, the hospital service laboratories, get out of stock. So when patients come, we don't have tools to use because maybe we cannot import, maybe there are issues. So and you told us about the actors, the government, the professionals, how to work together to solve the global challenge. So what do you expect us to do so that we can have we can meet continuous expectations of our clients? Thank you.
That is a fundamental question. I think thank you very much for raising that point. Dr. Barton, you are the Africa expert here.
Scribbling curious. Thanks very much. And yeah, the Nigerian market is a fascinating one because it's going to see a massive growth in the self-funded space. You're probably familiar with MD as a service, MDAS, which is a retail walk-in to get your tests done. And then, for generations, we've lived in this world where the doctor was the gatekeeper. You went to the doctor to find out what tests you need. We're now living in a space where you go to get the tests to find out if you need the doctor. And if so, which one you need. So Nigeria is already showing us the way in that changing service model. But your point about procurement and about sourcing and about local sourcing and local capacity development is absolutely vital. I don't think we're ever going to get to a place where the centralization services in laboratory businesses are going to be entirely decentralized. I think there will still be stuff that we will fly to other countries. At the moment, if you want to do a breast malignancy definitive in Kenya, that test gets flown to Johannesburg to be done. There will continue to be regionalization and perhaps even out of the continent movement for testing, but there's going to have to be far greater concentration of capacity. But if we want partners to invest, if we want partners to commit, then we also need to change the way in which we buy. We need to commit to offtake agreements that allow people to get return on investment. As we've just seen in COVID, we've had this huge amount of time, effort, and money spent on creating capacity to deliver tests, to deliver equipment, and to deliver even vaccine. And still, the governments and the global buying organizations are buying from international sources rather than from the invested organizations on the continent. So it's not just about what are the organizations going to do, it's about what are we going to do about changing the way in which we engage with and partner with those organizations.
And as I experienced our gradual change, one big factor was the universal coverage for the healthcare insurance system, universal coverage of all population, tax money or insurance. When it comes, the money will come, and your equipment and your reimbursement will come. So, and it all depends on the economic growth of your country. Money is important. We cannot ignore it. But when the country's political system is stabilized and they have a universal coverage, healthcare coverage for your people, and then there will be problems, but time will come. Then you do not have to worry about. Yeah.
Very much. Any other question? No. So, Dr.
So,
Lee,
yeah. And thank you. And as the COVID-19 pandemic ends, as you know, the previous rapid increase in revenue and profits of IVD companies will decrease. However, as the general public has realized the importance of the laboratory diagnosis, the diagnostics and testing market is expected to increase in demand compared to before the pandemic. The IVD companies will increase investment in R&D and M&A for developing new, simple, faster, and more accurate testing methods with the capital generated from COVID-19 pandemic. Although IVD companies will develop with their own investment, what we have learned from COVID-19 pandemic is that the strong support of government is essential for the growth of diagnostic industry. And the demand on POCT, as we talk about that, especially molecular POCT, will increase significantly. However, POCT has more opportunities for errors than when testing in the central laboratory, like GC labs. So, a strict quality control system is required for accurate test results. In addition, the role of central laboratories such as GC labs will be more emphasized for the confirmation of test results produced by POCT and confirmatory esoteric tests. And GC Labs is a leading reference laboratory with 40 years of experience and focused especially on esoteric testing with outstanding quality and are recognized globally. And the strategy for the preparedness for the next pandemic may vary depending on the economic situation, logistics, their population, and their infrastructure, and professional manpower of each country. Therefore, I think that each country shall establish some new policies for effective countermeasures through collaboration with private, public, and academic sectors. So, to bring this symposium to an end, I would like to thank my colleagues for attendance and sharing their expertise and opinions. Furthermore, I would like to thank everyone who has attended this workshop. And it is my hope that from this workshop, we can obtain some insights about the diagnostic market evolution and prepare for the next pandemic wisely and effectively. Thank you so much.